Welcome to the Deep Dive. Today we're tackling something you guys have been asking about for a while now.
Yeah, a lot of interest in this one.
It's the U.S. government's response to the COVID-19 pandemic.
Big topic, obviously.
It is a huge topic.
And we're using this pretty massive report from the Select Subcommittee on the coronavirus pandemic.
Yeah, this thing's a beast.
It is.
But don't worry.
We're going to break it down for you.
We'll help you navigate it.
Hit all the key points.
Yeah, and trust me.
There's some juicy bits in here.
There are.
Like, the WHO's early missteps.
Oh, yeah, that's a whole thing.
And then the American Federation of Teachers and the whole school closure situation.
Yes.
Oh, and how could we forget?
That New York governor.
Yeah, that whole debacle.
So, yeah, buckle up, folks.
It's going to be a wild ride.
Okay, so the report starts off setting the global scene,
Pandemic's emergence. And the WHO's initial response.
Right. And the Select Subcommittee found that the WHO was...
I mean, you can't sugarcoat it?
No.
They were way too reliant on information from the Chinese Communist Party.
Which potentially delayed that whole...
Public health emergency of international concern declaration.
Yeah, and that's a big deal.
Huge.
Could have really impacted global preparedness.
Absolutely.
And the report also mentions the CCP trying to control the narrative.
Like jailing doctors who tried to share information about COVID.
Seriously.
Yeah, it's wild.
Makes you wonder how differently things might have played out.
If there had been more transparency from the start.
Right, from the get-go.
Absolutely.
Okay, so let's move on to the U.S. response.
Right.
One thing that really jumped out from the report.
It's pretty shocking.
It is. It's the amount of fraud connected to pandemic relief funds.
We're talking potentially over $200 billion.
$200 billion.
Lost to fraudulent loans through those programs.
So like PPP and EIDL.
Exactly.
And the report goes into the systemic weaknesses.
Inadequate prepayment controls.
Failure to validate applicant information.
I mean, they basically left the door wide open for fraud.
And they give this specific example.
Oh, yeah, the Florida man.
Yeah, using stolen identities to get PPP loans.
Crazy.
Right.
It's insane.
This was money intended to help businesses.
Struggling businesses.
And it ended up in the wrong hands.
Big time.
It's a reminder that oversight and accountability.
Super important.
Especially when you're dealing with that much money.
Okay, so we've got a global health organization potentially downplaying the severity of the situation.
Right.
And then here in the U.S., billions lost to fraud.
It's a mess.
It is.
Mm-hmm.
So let's move on to the CDC.
Okay.
Specifically, their guidance on mask mandates.
Oh, boy.
Remember that whole roller coaster? Up and down.
Back and forth.
Yeah, the Select Subcommittee suggests that some of that back and forth
wasn't exactly based on science?
Potentially driven by politics.
Really?
That's what the report indicates.
Wow.
And they even mentioned Dr. Fauci saying that Americans misinterpreted the guidance on masks for vaccinated people.
But honestly...
The messaging wasn't very clear.
No, it wasn't.
Not at all.
And then on top of that...
Yeah.
The report highlights the CDC's reliance on studies with flaws.
Like that Wood County, Wisconsin study on mask effectiveness in schools?
Yeah, that one was questionable.
It really raises questions about the CDC's decision-making process.
It does. Okay.
Speaking of schools...
Oh boy, here we go.
This is where things get really controversial.
Remember all those debates about school closures?
Heated debates.
They were intense.
The Select Subcommittee specifically calls out the American Federation of Teachers.
The AFT.
Yeah, their lobbying efforts to keep schools closed.
Even when data started coming out suggesting that schools weren't major transmission hubs.
It's like they had an outsized influence on policy.
Like way too much power.
The report goes into detail about how the AFT even provided suggested language to the CDC for their operational strategy for K-12 schools.
No way.
Yeah. And some of that language,
which focused on school closure triggers based on positivity rates,
was actually adopted by the CDC.
So decisions about school closures,
which had such a huge impact on students and families,
might have been influenced more by political pressure than science.
It's a disturbing thought.
It is. Okay, let's switch gears to another controversial topic.
Right.
Gain-of-function research.
Yes.
And specifically EcoHealth Alliance's work with the Wuhan Institute of Virology.
This is where things get a little complicated.
Oh, boy.
The term gain of function has multiple definitions.
So already we're in murky territory.
Exactly. But even setting aside the definitions, the report raises some serious concerns about EcoHealth's grant.
Like what?
Late reporting of experiments and potential involvement in research that could have made bat coronaviruses more transmissible or more deadly.
That's scary stuff.
It is. And remember, Dr. Daszak,
The president of EcoHealth.
that's the one he testified before the subcommittee.
Right. And what did the report say about his testimony?
Well, there were some inconsistencies, let's just say.
Like what?
Remember his claim about being locked out of the reporting system?
Vague.
Well, emails and documents later contradicted that claim.
So he wasn't being entirely truthful.
Seems that way.
Okay. This is already a lot to unpack.
And we're just getting started.
Let's move on to a case that was all over the news.
Andrew Cuomo and the New York nursing homes.
That was a tough one.
The report goes into detail about that March 25th directive.
The one that ordered nursing homes to accept COVID-positive patients.
Yeah, even though it put those vulnerable residents at risk.
And then they tried to cover up the true number of deaths.
By excluding those who died in hospitals after being transferred from nursing homes.
Wow. So they were manipulating the data.
It appears so.
And the report even alleges that Cuomo himself was involved in editing a report on nursing home deaths.
Trying to downplay the impact of that March 25th directive.
That's a serious accusation.
It is, and it speaks to a broader pattern we've seen throughout this report.
What's that?
A tendency to prioritize politics over transparency and facts.
Yeah, it's a disturbing trend.
It is. Okay, let's zoom out a bit and look at the bigger picture. Okay, vaccine mandates and their impact on individual rights and the doctor-patient relationship.
That whole debate was so divisive.
It really was.
And the report doesn't shy away from exploring the potential negative consequences.
Decreased trust in public health institutions,
Increased political polarization.
job losses, economic hardship.
Yeah, it was rough for a lot of people.
And one of the most concerning findings,
Was that?
FDA officials considered the need to support mandates when they were speeding up the approval process for the COVID vaccines.
Wait, so they were thinking about mandates before the vaccines were even fully approved?
That's what the report suggests.
That's wild. It makes you wonder if the science was truly independent.
It does raise questions.
What about those who had side effects from the vaccines?
Were there systems in place to support them?
That's a good question.
Well, the report focuses on VAERS and CICP, which are supposed to identify and compensate for potential vaccine injuries.
To be honest, those acronyms are a little intimidating.
They are VAER stands for the Vaccine Adverse Event Reporting System.
Okay.
And CICP is the Countermeasures Injury Compensation Program.
So those are the systems meant to track and address any potential harm from vaccines.
Exactly. And while they're important, the report highlights some serious limitations.
Like what?
Well, let's start with VAERS.
Okay.
The report suggests it might be missing crucial safety signals, especially when it comes to neurological conditions.
Like what?
You remember that New York Times article from May 2024?
The one about people feeling like their vaccine injuries were being ignored?
Yeah, that one.
Yeah, it was heartbreaking.
They talked about people experiencing things like tinnitus and brain fog after getting vaccinated.
And they felt like no one was listening.
Exactly. The report even quotes Dr. Woodcock.
The former FDA head.
Right. He talked about the difficulty of finding clear evidence of those conditions in medical records.
So it's like those neurological symptoms don't fit neatly into a box for diagnosis.
And that raises concerns about whether they're being adequately tracked and addressed.
What about vSafe?
That smartphone-based tool.
Yeah, I thought that was supposed to be a faster way for people to report side effects.
It was. But the report reveals that a lot of the important data was hidden in free text fields.
So it was hard to analyze.
Exactly. Which makes you wonder if they were really committed to understanding the full scope of vaccine-related issues.
What about CICP?
That one seems to be facing a massive backlog of claims.
So people are stuck waiting for support and answers.
Sometimes for years.
The report said it could take almost a decade to clear the current backlog.
Even with them processing claims faster.
That's crazy.
It is. And the lack of a streamlined process for COVID vaccine injury claims just adds to the problem.
So what's being done about it?
Well, CICP is working on establishing an injury table for these vaccines.
Which could speed things up.
In theory, but it's still a work in progress.
So the system is lagging behind.
Big time.
Didn't the report also say that these issues with compensation could actually fuel vaccine hesitancy?
Yes. It pointed to a Politico article that argued that Congress hasn't done enough to address this overwhelmed system.
So we're encouraging vaccination on one hand,
but then not providing adequate support for those who might be harmed.
It's a tough situation.
It is the report quotes Dr. Renee Gentry, who said that the failing of the CICP could be like throwing kerosene on the anti-vax fire.
Wow, that's powerful.
It is, and it speaks to the whole issue of trust in public health.
Which has been eroded.
For sure, the whole vaccine mandate situation, especially with limited liability for manufacturers.
Yeah, that didn't help.
It created a situation where people might not have had a real chance to talk to their doctors about the vaccines.
Weigh the risks and benefits.
Make an informed decision.
The report specifically mentions the difference between an emergency use authorization and a full biologics license application.
Big difference.
Huge. For an EUA, it only has to be shown that a product may be safe and effective.
But for a full BLA approval,
It has to be proven that it is safe and effective.
that's a much higher bar.
And I doubt most people even knew about those distinctions.
I didn't.
Me neither. It feels like that lack of transparency just added to the confusion and distrust.
The report points out how this difference in standards might have negatively impacted the public's perception of the vaccines.
And it says that FDA officials were concerned about this.
And used it as a reason to push through the full BLA approval as quickly as possible.
Almost like they were trying to play catch up with public trust.
But the damage was already done.
And then the mandates just made things worse.
They really did. The report highlights testimony from people like Dr. Jeffrey Singer,
Who argued that forcing someone to do something medical, even if it's a good idea, leads to pushback.
and a breakdown of trust.
We all want to feel like we have control over our own bodies and healthcare decisions.
Absolutely.
The report also mentions Congressman Brad Wenstrup.
Who shared his personal experience,
He got vaccinated, then got COVID, then checked his antibody levels.
which were very high.
And his question was, why should he get a booster if he already had such a strong immune response?
It's a valid question.
It is, and it highlights how individual needs were often overlooked in the rush to vaccinate everyone,
And that brings us to natural immunity.
which was a hot topic throughout the pandemic.
There was so much debate about whether a prior infection provided protection.
And it felt like that discussion was often shut down.
The report points to a study in The Lancet.
What did it say?
It found that natural immunity offered similar protection as 2 doses of an mRNA vaccine.
Really?
Yeah, reducing the risk of hospitalization and death by 88% for at least 10 months.
That's huge.
It's like the science was supporting the idea that natural immunity was a real thing.
But that message wasn't widely shared.
No, it wasn't.
The report even mentions the Great Barrington Declaration,
That proposal from a group of epidemiologists and infectious disease experts.
the one that advocated for a more focused approach to the pandemic.
Protecting the vulnerable while allowing those at lower risk to live more normal lives.
I remember that being pretty controversial.
It was met with a lot of pushback.
What happened?
The report highlights how Dr. Fauci and Dr. Collins from the NIH actively sought to discredit it,
So certain voices and perspectives were being silenced?
even when they were backed by scientific data.
It goes back to that lack of transparency we were talking about.
If we can't have open and honest debate, how can we make informed decisions?
Exactly. Okay, let's shift gears and talk about the economic fallout of the pandemic response.
Right.
We all felt the effects of lockdowns and business closures.
Some more than others.
Definitely the Select Subcommittee's report really digs into this.
It outlines how the government's actions, especially around lockdowns and social distancing, contributed to a lot of economic hardship.
Makes sense. Forcing businesses to shut down or operate at limited capacity would have consequences.
Especially for small businesses.
And lower wage workers.
Exactly. The report starts by outlining the massive amount of federal spending
Trillions of dollars.
pumped into the economy through various programs.
So they were trying to soften the blow with spending.
Right, but the question is, were those programs effective?
Good question. I remember prices on everything going up.
Inflation became a major issue.
Was that connected to the government spending?
The report argues that it was the massive spending combined with supply chain disruptions created a perfect storm.
So the solution to one problem might have contributed to another.
And beyond inflation, the report looks at the impact of lockdowns on businesses.
Yeah, those are tough.
It argues that arbitrary and overly broad restrictions, often implemented without enough scientific justification, led to widespread business closures, job losses, and long-term economic damage.
When businesses close, people lose their jobs and the whole economy suffers.
Exactly. And the report highlights how this impact wasn't evenly distributed.
Meaning?
Rural and low-income communities were hit harder.
Why is that?
They often have limited access to capital, rely more heavily on small businesses, and have fewer job options.
So when those small businesses are forced to close, the effects are more severe.
It's a domino effect.
It's a reminder that even policies intended to help can have unintended consequences.
Especially for those who are already struggling.
Okay, what about the Federal Reserve? They play a big role in the economy.
They do. The report sheds some light on their actions during the pandemic.
What do they do?
Their main focus was stabilizing the financial system and stimulating growth.
How'd they do that?
Lowering interest rates, purchasing assets, providing liquidity to banks,
Basically trying to pump money into the system.
and make it easier to borrow and spend.
So they were trying to prop up the economy while everything else was shutting down?
Exactly. They also used forward guidance,
What's that?
communicating their intentions to the market to reassure investors and stabilize expectations.
So communication played a big role.
Huge. If people lose confidence in the system, things can spiral out of control.
Makes sense. The report details specific actions they took throughout 2020 and 2021.
Highlighting the scale of their intervention.
Like emergency responders trying to stabilize a critical patient.
But as with any intervention, there can be side effects.
So what were the potential downsides?
Some economists argue that their actions, especially the massive asset purchases, might have contributed to asset bubbles and increased financial instability.
So they might have solved one problem, but created another.
It's a delicate balance,
This whole pandemic response seems like a tangled web.
with every action having both intended and unintended consequences.
Let's go back to school closures for a minute.
Okay.
That was a tough time for everyone.
Parents, teachers, students.
The report dives into the decision-making process.
Examining the influence of teachers' unions and the CDC's guidance,
It starts by emphasizing the impact closures had on students.
both academically and socially.
I think we all knew that kids learn better in school and that social interaction is important,
But the report actually presents data from studies showing significant learning loss.
especially among disadvantaged students.
So the pandemic made existing inequalities worse.
What about mental health?
The report highlights increased rates of anxiety, depression, and suicidal thoughts among students.
That's awful.
Their whole world was turned upside down.
And many struggled to cope.
And remember how the CDC's guidance on closures changed over time?
Yeah, they initially recommended keeping schools closed.
But as evidence emerged suggesting schools weren't major transmission vectors, they shifted towards reopening.
So they were following the science.
Well, the report questions whether they were always objective.
Meaning?
It points to instances where they seem to prioritize the views of teachers' unions over scientific evidence.
Specifically.
The American Federation of Teachers.
So the AFT might have influenced the CDC's guidance.
That's what the report suggests.
Wow, what kind of influence?
The report details communications between AFT officials and the CDC, including suggested language for guidance documents.
So they were actively trying to shape the CDC's recommendations.
And the CDC was receptive in some cases.
For example,
The AFT pushed for school closure triggers based on positivity rates, which the CDC adopted.
even though there wasn't much scientific justification for that metric?
It raises concerns about whether the best interests of students were truly the priority.
Were they putting kids first, or were other factors at play?
It's a question worth asking.
It's a reminder that even in a crisis, politics and special interests can still have influence.
And sometimes that influence has unintended consequences.
Especially for the most vulnerable.
Well said. Okay, let's move on to another section of the report.
Okay,
This one deals with potential obstruction of the Select Subcommittee's investigation.
hold on. There was potential obstruction of justice.
That's what the report alleges.
This is getting intense.
It is. The report details multiple instances where HHS EcoHealth Alliance and Dr. Daszak himself seem to have hindered the subcommittee's access to information.
So they were stonewalling a congressional investigation.
Essentially.
What did they do?
For example, HHS produced thousands of pages of documents.
This sounds like a lot.
It is. But a simple FOIA request from a private citizen got even more documents from the same agency.
That's strange they gave more information to a regular person than to Congress.
The report suggests that HHS was selectively redacting and withholding information.
To protect certain people or agencies.
Potentially.
That's shady.
It is. And it doesn't exactly inspire trust.
What about Dr. Daszak and EcoHealth Alliance?
They didn't exactly cooperate either.
What they do?
The report says they provided incomplete documents, delayed responses, and tried to control the narrative through press releases.
Trying to spin the story.
Exactly.
So instead of being open and honest, they were playing games.
It seems that way.
And that lack of transparency made it harder for the subcommittee to get the full picture.
Like trying to solve a puzzle with missing pieces.
This whole deep dive has been like that.
We've learned a lot.
But there are still so many unanswered questions.
It's both fascinating and frustrating.
It is, and that's what makes this report so important.
It's a call for more transparency, more accountability, and a more thorough investigation.
Okay, we've covered a lot of ground here.
From the WHO to vaccine mandates, the economy, school closures, and even potential obstruction of justice.
It's clear that the government's response had both successes and failures.
But the most important thing is that we learn from this experience and do better next time.
What stood out to you the most from the report?
For me, it's the recurring theme of political influence and lack of transparency.
Yeah, it seems like decisions were often driven by agendas rather than science or the needs of the people.
And the potential obstruction of justice is very concerning.
It feels like we're only seeing the tip of the iceberg.
I encourage everyone to read the full report.
It's a lot to digest.
But it's full of important details.
And let us know what surprises you the most.
This conversation is far from over.
We need to keep asking questions and demanding answers.
Thanks for joining us
For another deep dive.
into a topic that matters.
Yeah, it's unsettling, isn't it?
It is. To think about how decisions made behind closed doors can impact all of our lives.
It really makes you think about transparency.
Right. Was there enough of it?
Well, that's a key focus in the report.
Is it?
Yeah. The Select Subcommittee dedicated a whole section to investigating potential obstruction of their investigation. So it wasn't just about figuring out what happened during the pandemic.
Right.
It was also about figuring out who might be trying to cover things up.
Exactly.
Okay, so what did they find?
They detail multiple instances where HHS, EcoHealth Alliance, and even Dr. Daszak himself appear to have hindered the subcommittee's access to information.
So they were basically stonewalling a congressional investigation.
Pretty much.
That's a big deal.
It is. Makes you wonder what they were so afraid of revealing.
Right. What kind of tactics were they using to obstruct the investigation?
Well, for one, HHS produced thousands of pages of documents to the subcommittee.
Okay.
But a simple FOIA request from a private citizen actually yielded even more documents from the same agency.
Wait, so they gave more information to a regular person than to Congress?
That's what happened.
Why? What possible explanation could there be for that?
The report suggests that HHS might have been selectively redacting and withholding information from the subcommittee,
Why?
potentially to protect certain individuals or agencies.
It really makes you question their commitment to transparency.
It does.
And it definitely erodes trust in the government.
For sure.
Okay, what about Dr. Daszak and EcoHealth Alliance?
They weren't exactly cooperative either.
How so?
The report criticizes them for providing incomplete documents, delaying responses, and even trying to control the narrative through press releases.
So instead of being open and honest, they were trying to spin the story.
That's the impression you get.
It's disappointing.
It is. And that lack of transparency made it much harder for the subcommittee to get a clear picture of what really happened.
It's like trying to solve a puzzle with missing pieces.
Exactly.
Which is kind of what this whole deep dive has felt like.
We've uncovered a lot.
We have, but it feels like there's still so much more to uncover.
There's still so many unanswered questions.
It's both fascinating and frustrating.
I know what you mean.
And it makes this report so important.
It's a call for more transparency, more accountability, and a deeper investigation.
So where do we go from here?
I think the most important thing is that we learn from this experience.
What do you mean?
We need to demand better preparedness and transparency for the future.
So that if something like this happens again,
We're better equipped to handle it.
and we can hold those in power accountable.
Exactly.
Okay, so we've talked about a lot of heavy stuff today.
I have?
From the WHO to vaccine mandates, the economy, school closures, and even potential obstruction of justice.
It's been a lot.
It has, but it's important to talk about these things.
Absolutely. We can't just sweep them under the rug.
So what's the takeaway here?
The government's response to the pandemic had both successes and failures.
Okay,
But what matters most is that we learn from it and do better next time.
that's a good point. What stood out to you the most from the report?
For me, it was the recurring theme of political influence and lack of transparency.
That's a big one. It seems like decisions were often driven by agendas rather than science or the needs of the people.
And the potential obstruction of justice is very concerning.
Makes you wonder what else is out there.
I encourage everyone to read the full report if you're interested.
It's dense, but it's worth it.
It is. And let us know what you think.
What surprised you the most? What questions you still have?
This conversation is far from over.
We need to keep asking questions and demanding answers.
Thanks for joining us on The Deep Dive.
For another deep dive into a topic that matters.
Yeah, it's unsettling to think about how decisions made behind closed doors can have such a huge impact on all of our lives.
Right. And it really makes you wonder about transparency.
Was there enough of it during the pandemic?
Well, that's a big part of what this report is trying to uncover.
Is it?
Yeah, the Select Subcommittee actually dedicated a whole section to investigating potential obstruction of their investigation.
So it wasn't just about what happened during this pandemic.
Yeah.
It was also about who might be trying to cover things up.
Exactly.
That's wild. Okay, so what did they find?
The report details multiple instances where HHS, EcoHealth Alliance, and even Dr. Daszak himself appear to have hindered the subcommittee's access to information. So they were stonewalling a congressional investigation.
Essentially, yeah.
That's a serious accusation.
It is. It makes you wonder what they were so worried about revealing.
Right. What kind of tactics were they using?
Well, for one, HHS produced thousands of pages of documents to the subcommittee.
Right.
But a simple FOIA request from a private citizen actually got even more documents from the same agency.
That's unbelievable. So they were more willing to be transparent with a regular person than with Congress.
That's what it looks like.
Why would they do that?
The report suggests that HHS might have been selectively redacting and withholding information from the subcommittee.
Why would they do that?
Potentially to protect certain individuals or agencies?
That's a bad look.
It is, and it really undermines trust in the government.
If they're not being honest with their own investigations, what else are they hiding?
Right, and the report also mentions a senior advisor at NIAID, Dr. Morens.
Oh, okay.
He admitted to using his personal Gmail account for official business.
To avoid FOIA requests.
Ex-
So he was deliberately trying to circumvent transparency rules?
It seems that way.
Why would he do that?
Well, he tried to justify it by saying it was a policy violation, not a crime.
But still, it's not a good look.
No, it isn't. It raises questions about his judgment and his commitment to transparency.
Okay, what about EcoHealth Alliance and Dr. Daszak?
They weren't exactly angels either.
What do you mean?
The report criticizes them for a lack of cooperation.
How so?
They were accused of providing incomplete documents, delaying responses, and trying to control the narrative through press releases.
So instead of being open and honest, they were trying to spin the story.
That's one way to put it.
And that lack of transparency really hindered the subcommittee's ability to figure out what happened.
Absolutely. It's like trying to solve a puzzle with missing pieces.
You know, this whole deep dive has felt like that.
Yeah, we've uncovered a lot of information.
We have, but it feels like there's still so much we don't know.
It's true, there are still so many unanswered questions.
It's both fascinating and frustrating.
I know what you mean.
And it makes this report so important.
It's a call for more transparency, more accountability, and a more thorough investigation into the government's pandemic response.
So where do we go from here?
Well, I think the most important takeaway is that we need to learn from this experience.
And do better next time.
Exactly. We need to demand better preparedness and transparency from our leaders.
So if something like this happens again,
We'll be better equipped to handle it.
and we'll be able to hold those in power accountable.
Absolutely.
Well, this has been a really thought-provoking deep dive.
It has.
We've covered so much ground, from the WHO's initial response to vaccine mandates, the economic fallout, school closures, and even potential obstruction of justice.
It's been a lot to process.
It has, but it's important that we talk about these
You
things.
can't just pretend they didn't happen.
So what would you say is the biggest takeaway?
The government's response to the pandemic was complex.
Okay.
There were both successes and failures.
And we need to learn from both.
Exactly. So we can be better prepared for the future.
That's a great point. What surprised you the most about the report?
For me, it was just how much political influence and lack of transparency there was.
Yeah, that was a recurring theme throughout the whole thing.
It makes you wonder if decisions were always being made in the best interests of the people.
It does, and the potential obstruction of justice is very troubling.
It is. It really makes you question what else might be out there.
It does. I encourage everyone listening to check out the full report if you're interested.
It's a long read, but it's full of fascinating details.
And let us know what you think.
What surprised you the most? What questions you still have?
This conversation is far from over.
We need to keep asking questions and demanding answers.
Thanks for joining us on the deep dive for another exploration of a topic that matters.
We'll see you next time.